After 60, many people carefully line up their supplement bottles on the kitchen counter and swallow them with hope. A capsule for the heart, a tablet for the bones, another for energy or memory. It feels responsible, even necessary. But here is the part no one explains. The moment you pass 60, your kidneys, liver, and blood vessels handle those pills differently than they did at 30. Some combinations that look harmless on the label can quietly thin your blood too much, block your medicine, or stop your body from absorbing what you need. In this video, I will walk you through 4 supplement pairings that can quietly turn helpful pills into a risky mix, and how to use supplements in a way that safely protects, not threatens, your health. Why supplements behave differently after 60. Let us begin with a simple but uncomfortable truth. Your body at 60 is not the same machine it was at 30 or 40. That does not mean it is broken. It means it is different. Your liver may process substances more slowly. Your kidneys may filter more gently. Your stomach may produce less acid. Your blood vessels and heart are often working under more pressure than they used to. Now, place supplements into that picture. Each capsule, powder, or tablet is a concentrated dose of a chemical your body has to handle, sort, and send to the right place. When you were younger, your system could usually bounce back from overdoses and odd combinations. After 60, the safety margin is smaller. Pills stay in your system longer. They may hit harder. And if you stack the wrong ones together, you can push your body past what it can calmly correct. There is another piece that makes this stage of life different. Most older adults are not just taking one thing. You may be on medication for blood pressure, diabetes, heart rhythm, pain, or cholesterol. Then you add supplements for bones, heart health, brain health, and energy. Very often, no single person has looked at the full picture at once. On the label, each bottle looks harmless. A vitamin here, a mineral there. But inside your bloodstream, they do not exist in separate boxes. They meet, interact, compete, and sometimes block or amplify each other. That is where trouble starts. This video is not about scaring you away from every supplement. It is about turning on the lights so you can see the combinations that are most likely to cause harm. Once you understand those, you can make small, smart changes that keep the benefits you want and lower the risks you do not. The quiet problem with taking calcium and iron together. The first dangerous pairing is one many people take without thinking twice. Calcium and iron. Both sound positive. Calcium for strong bones, iron for energy and red blood cells. You might even see them in the same day of a pill organizer and feel proud that you are covering all bases. Here is what almost no one tells you. Calcium and iron use some of the same doors in your small intestine to get into your bloodstream. When they arrive at the same time, they compete to be absorbed. Calcium is pushier. It tends to win. Iron quietly loses and passes out of your body unused. What does that mean in everyday life? Imagine you are taking an iron supplement because your blood work showed low levels. You feel tired, short of breath on stairs, maybe a little dizzy when you stand up. Your doctor suggests iron. You take it faithfully. But if you wash it down with a glass of milk, or take it side by side with a calcium pill, you can block most of the benefit. On paper, you are treating your anemia. In reality, your iron stores barely rise. You stay tired and short of breath. Your heart has to work harder to deliver oxygen. In someone over 60, that can add strain to a heart that is already doing its best. The solution is not to panic or throw out your supplements. It is to separate them. Iron prefers to be taken on its own or with vitamin C-rich foods like fruit, which can help absorption. Calcium is usually better taken with food at another time of day. For many people, that might mean iron in the late morning or early afternoon, and calcium with an evening meal or at bedtime. The key lesson is simple. Two good things are not always good together. Your job is to give each supplement room to work instead of letting them trip each other up. When fish oil and blood thinners make your blood too thin, the second pairing involves fish oil and blood thinning medicines. Fish oil is widely praised. It supports heart health, brain function, and may calm some types of inflammation. Many seniors take it for joints, memory, or general protection. On its own and in proper doses, it can be helpful. But fish oil has a specific effect that matters if you already take blood thinners. It makes platelets, the tiny cell fragments that help your blood clot, less likely to stick together. That is one reason it may protect against clots. Now combine that with a prescription blood thinner such as warfarin, clopidogrel, apixaban, rivaroxaban, or even a daily aspirin. Those medicines are already slowing clotting to prevent strokes, heart attacks, or clots in your legs. Stacking fish oil on top can push the system too far. Your blood can become so slow to clot that a small bump or minor fall leads to a large bruise, a nosebleed that will not stop, or in the worst case, bleeding inside your head or gut. The tricky part is that this does not always show up right away. You might combine fish oil and blood thinners for months without any obvious problem. Then one day you clip the edge of a table or slip in the garden and the bruise is enormous. Or you notice black stools or severe headache and do not immediately connect it to the extra omega-3 capsules you added on your own. Again, the answer is not to declare fish oil evil. It is to treat it with the same respect you would give a medicine. If you are on any blood thinner, never add fish oil without a conversation with your doctor or pharmacist. Ask directly, does a fish oil supplement make sense for me with this medication? And if so, in what dose? Sometimes the answer will be that your diet already gives enough omega-3, or that the bleeding risk outweighs the benefit. Other times, your healthcare provider may allow a small dose but adjust your prescription or monitor your blood more closely. The key is that the decision should be made with full awareness, not by guessing. Vitamin K, leafy greens, and warfarin. Why consistency matters more than perfection. The third combination is more subtle. It involves vitamin K and older-style blood thinners such as warfarin. Vitamin K is not a villain. Your body needs it to help blood clot when you cut yourself. It also plays a role in bone health. You find it in many multivitamins and in foods like spinach, kale, broccoli, and other leafy greens. Warfarin, on the other hand, works by gently blocking vitamin K from doing its clotting job. That is how it lowers the risk of strokes and clots in people with certain heart conditions or a history of clotting problems. You can probably see the tension already. If you take a warfarin tablet and also swallow a large vitamin K supplement, or suddenly start drinking big green smoothies every day, you can cancel out your medicine. Your blood may clot more easily again, raising your stroke risk. On the flip side, if you have been eating a steady amount of greens and then suddenly stop, the warfarin effect can become stronger than intended. Your blood may become too thin, raising your bleeding risk. The danger is not in eating vegetables or even in having vitamin K. The danger is in swings. 1 week of daily spinach, followed by a week of almost none, can throw your clotting levels up and down like a seesaw. Your warfarin dose is usually set based on what your doctor thinks your normal intake is. If that intake jumps or crashes, the dose no longer fits. What should you do if you are on warfarin or a similar medicine? First, do not avoid healthy foods out of fear. Instead, aim for a steady pattern. If you enjoy a salad each day, keep enjoying a salad each day. If you rarely eat leafy greens, do not suddenly flood your system with them without telling your doctor. Second, check your multivitamins. Some contain added vitamin K. If yours does, your healthcare provider should know about it so they can factor it into your dose and monitoring schedule. Never start or stop a vitamin K supplement quietly in the background. Mention it every time your dose is adjusted or your levels are checked. With warfarin, the safest path is not perfection. It is predictability. Magnesium, minerals, and the antibiotics that cannot do their job. The fourth risky mix is not about bleeding or clotting. It is about blocking medicine from working at all. Many seniors take magnesium for muscle cramps, sleep, constipation, or heart rhythm support. Others take combined mineral supplements that include calcium, magnesium, zinc, and sometimes iron in the same tablet. On their own and at sensible doses, these minerals can be useful, but certain antibiotics and thyroid medications can latch onto them in your gut and form complexes that your body cannot absorb. This is especially true for some common antibiotics used for urinary tract infections, chest infections, or skin infections. Picture this. You are prescribed an antibiotic for a significant infection. You line up your pills for the day and proudly take your antibiotic together with your usual evening mineral supplement, thinking you are being efficient. In your stomach, the antibiotic and minerals join together. Instead of passing through the gut wall into your bloodstream, they stay in the digestive tract and leave your body the next time you go to the bathroom. You did everything your doctor asked. You finished the course, but inside your body, the infection never received a full dose of medicine. It lingers or worsens. You may end up back at the clinic or hospital, needing stronger drugs for a longer time. In some cases, this can contribute to bacteria becoming resistant. The fix is surprisingly simple. If you are prescribed an antibiotic, ask specifically about timing with your supplements. In many cases, your provider will recommend that you take minerals at least 2 hours before or several hours after your antibiotic, or even pause certain supplements until the infection is treated. For thyroid medicine, such as levothyroxine, a similar principle applies. Minerals, coffee, and some foods can interfere with absorption. Usually, it is best taken alone on an empty stomach, with other pills delayed. The rule of thumb is this: whenever you start a new prescription, assume it may have timing rules. Ask, do any of my supplements need to be separated from this medicine so it can work properly? Do not leave it to chance. Building a safe supplement map instead of guessing. Now that you have heard about these 4 dangerous pairings, it is easy to feel overwhelmed. You might be thinking, if calcium can block iron, if oils can thin my blood, if vitamins can fight my medicine, how am I supposed to keep track of any of this? The answer is that you do not have to carry it all in your head. You need a clear map. One of the most powerful things you can do for yourself after 60 is to create a simple supplement and medication list and treat it like a living document. Start with a piece of paper or a notebook, whatever feels natural. Write down every prescription medicine you take, including the strength and how often. Then add every supplement, no matter how harmless it seems. Multivitamins, fish oils, calcium, magnesium, herbal pills, sleep gummies, powders you stir into drinks, and even regular use of herbal teas like dandelion or ginseng. If it goes into your body most days, it belongs on the list. Next, note the times of day you usually take each one. Morning with breakfast, midday, evening with dinner, bedtime. Do not worry about being perfect. Just capture your real routine. Then bring this list to your pharmacist or doctor. Pharmacists in particular are trained to spot interactions and timing problems. They often have more time than a doctor does in a short appointment. Ask them to look specifically for supplement and medicine conflicts and for any combinations that need spacing. What you are building is a safe schedule. Out of that review might come simple changes. For example, moving calcium to bedtime so it does not fight with iron. Stopping fish oil while you are on a strong blood thinner. Separating minerals from antibiotics. Choosing a multivitamin without vitamin K if your warfarin levels are unstable. Once you have this map, keep it where you can see it. On the fridge, by your pill box, in a small notebook on your table. Update it whenever a doctor changes a dose or you add or remove a supplement. That way, you are not guessing day by day. You are following a plan that your health team has checked. Choosing fewer, smarter supplements and more nutrition from food. There is another important idea hiding under all of this. Many people over 60 take a long list of supplements because they want to feel safer. More pills looks like more protection. In reality, the opposite is often true. The longer the list, the harder it is to avoid harmful overlaps. A quieter, safer strategy is to aim for fewer, smarter supplements and more nutrition from real food. Ask yourself, which of these bottles do I truly need based on testing and medical advice, and which did I start because of an advertisement, a friend, or a habit? For example, if your bone scan and blood work show that you genuinely need more calcium and vitamin D, those may deserve a place at the front of the line. If your iron stores are normal, you may not need an iron pill at all. If your diet already includes regular fish, nuts, seeds, and olive oil, you may not need an additional generic omega-3 capsule. Food-based nutrients often arrive in balanced packages. A piece of salmon does not give you only omega-3. It brings protein, selenium, and other supportive nutrients. A plate of leafy greens gives you vitamin K along with fiber and minerals that help digestion and blood sugar. Nuts and seeds bring magnesium, vitamin E, and healthy fats and forms your body recognizes. This does not mean food can replace every medicine or every targeted supplement. But leaning on nutrition as your base and using pills to fill proven gaps keeps your total chemical load lower. That gives your liver, kidneys, and blood vessels less juggling to do. So before you add a new supplement because you heard it was good for memory or joints, pause and ask 3 questions. Do I have a clear reason for this? Has a professional who knows my history agreed? And how will this new pill fit safely with what I already take? A simple 7-day reset to make your routine safer. By now, you may be seeing your bathroom shelf or kitchen counter in a new way. Bottles that once looked comforting may look a little more complicated. Instead of throwing everything away, I invite you to try a calm, 7-day reset. Day 1. Write your complete list of medicines and supplements, including doses and times. Day 2, circle anything on that list that we discussed in this video: calcium, iron, fish oil, vitamin K, magnesium, multivitamins that contain several minerals, and any blood thinners or antibiotics. Day 3, take that list to your pharmacist or doctor, in person or by phone, and ask directly about dangerous combinations and timing. Day 4, with their guidance, adjust your schedule. Maybe iron moves to mid-afternoon, calcium moves to nighttime, fish oil is stopped for now, and minerals are kept several hours away from any current antibiotics or thyroid medicine. Day 5, pay attention to how you feel. Notice bruising, energy, digestion, and leg strength. No need to obsess, just observe. Day 6, look again at your list and ask, is there one supplement I can safely stop because my food covers it or my tests are normal? Discuss this with your provider. Day 7, create a clean written schedule that you keep near your pill organizer. From now on, each new pill must earn its place on that schedule, not slip in quietly. This is not about being perfect. It is about being intentional. You are turning a random stack of bottles into a routine that fits your age, your organs, and your real needs. For now, I do not want you to feel afraid of every bottle in your cupboard. I want you to feel informed and in charge. Over the next week, take 10 quiet minutes to list every medication and supplement you use, including multivitamins, oils, powders, and herbal teas. Bring that list to your pharmacist or doctor and simply say, I want to make sure these are safe together. Then, practice one new habit from this video, whether it is separating calcium and iron, asking about fish oil with blood thinners, or spacing minerals away from antibiotics. Small changes add up quickly, especially after 60. If you want calm, science-based guidance made for older adults, not for teenagers in a gym, subscribe and stay with this channel. In the comments, share one supplement change you will make this week. Your story might be the warning that quietly protects someone else.